This is the pectoralis major muscle and is the commonest cause of chest pain from trigger points. There are 5 trigger points in the pectoralis muscle, and the first sits right over the sternum itself. There's not a lot of muscle thickness here, and this causes pain over the center of your chest, often spilling to the other side. The second sits towards the bottom of the muscle, close to the nipple. The third sits a little bit higher in the center of the muscle, and the fourth sits in this little depression just below the clavicle. There's a little depression that most people have, and that's where the fourth lives. The fifth is in the free edge. So the pectoralis major muscle has a free edge like some other muscles in the body, and therefore the way to find this trigger is to stick your thumb underneath and squeeze. The triggers on the side of the pectoralis major muscle often refer pain down the inside of the arm. So to treat your own triggers, you will take your other hand and feel and search for areas which are painful. As you find, once you've found a painful area, you press on that. Now sometimes you could use your other hand, so you could take your other hand just to support it, and you press down firmly enough to cause pain. Once you found the point and it's sore, you now reduce the pressure until there is no pain, but stay on that point, and then you gradually increase the pressure, staying below the pain threshold. While you're doing this, you're turning off the trigger, and you need to do this usually for between 90 and 120 seconds. Once you can push as hard as you like, that means you've turned that trigger off. You then put your attention to all the others, and once they're all switched off and your whole chest, all the triggers in your chest are quiet, you now, thank you, need to stretch the pectoralis major muscle. So now you need to stretch the muscle out to length, and the easiest way to do that is to lean your elbow against a wall, and then you just rotate your body forward, and as you go forward like this, the muscle stretches out. You can do this in a corner of a house. You can do this against the lintel of a door, pressing in. And so you come forward. As it stretches, take a deep breath in, hold for the count of 6, 3, 4, 5, 6. Breathe out. Don't breathe in, just rest a couple of seconds, and then keep stretching forward. Very good. And that will switch off the triggers. By stretching the muscle out to length, you make it less likely that they will recur, and will give you freedom in your chest. I just want to reiterate, very important, chest pain is a really important symptom that you cannot afford to ignore. So if you present with chest pain, the most important cause is your heart, and you need to make 100% sure that you've ruled out the heart as a cause of your chest pain before you look at trigger points.